far as the color goes, we can mix. We can just do colors by themselves.
Chelsea Gibbs is selecting tattoo coloring that will help give her reconstructed breast and their anatomy the most natural look.
This is golden brown, and that one's right there.
Just a few days shy of her 25th birthday, Chelsea was diagnosed with breast cancer. A lumpectomy and radiation treatment saved her life and her breast. 12 years later, she was diagnosed again, and the treatment would be more drastic, double mastectomy.
I couldn't imagine seeing myself with nothing there. For a little bit, I fought it. It was sort of devastating, but then I realized, okay, you get to start all over and have some great new breasts and keep going.
Studies have shown that women do better by having reconstruction, and it's more of a mental perception or self-esteem issue that I think is very important to their overall recovery.
Plastic surgeon Dr. Rhett Highs with Raleigh Plastic Surgery Center performed Chelsea's prosthetic breast reconstruction using implants.
You start initially with what's called a tissue expander, which in layman's terms is a balloon that's put underneath the skin and the muscle on the chest wall. You then serially inflate this over time with multiple clinic visits to the office. And by the time the skin and the muscle are stretched out to the appropriate area, it's time to remove the tissue expander and then replace it with a permanent implant.
Then nipple reconstruction and tattooing, Chelsea's last step in a treatment process that gives her more confidence about her looks and less worry about cancer returning.
I didn't want to spend the time to think about it again or worry about it. I have a whole lot of other things to do and think about besides that.
She's a young lady who has shown a great deal of courage by facing this head on.
Dr. Highs considers reconstructive surgery his most rewarding work.
You're seeing these patients through chemotherapy, you're seeing them through radiation therapy, and usually surgery's at the tail end of all that treatment. And so you can't help but feel rewarded that you've really improved these people's lives.
I've happened to come out on the very, very good end of it.